Good. Chairman Cowsert, do you mind opening us up in prayer, please, sir?
Please join me in prayer. I'm number 5. Lord, thank you for all the many blessings you've given us and the benefits you've afforded us, giving us the privilege to serve in these roles. Thank you for our system of government and public participation, and to have all the interested citizens and representatives and senators here today to work together towards a common good. Help us be mindful of the needs of others and grateful for everything you've given us. Amen.
Thank you, Chairman Cowsert. Appreciate that. So this, just for clarification, this is the Senate Health and Human Services. This is the full committee. So the subcommittee that is meeting on 10/13 will meet at 3 o'clock. So I know we may have had some folks sign up, and but 10/13 is not till 3, and saving seats. I think there may or may not be a meeting after here, so we just want to make sure everybody has access to this meeting. So all right, so we're going to collect the sign-up sheets, and we're going to write down the agenda. House Bill 1355. Representative Dempsey discuss this bill a little bit further, and this time we're just going to clarify this. And we do have, I think if I remember correctly, a substitute which is in our folder for House Bill 1353. There were some minor changes between last week and this week, and if you can, yes, if you don't, absolutely.
From DPH.
Yes.
In case there are some direct questions for that as well. Yes, the substitute I have is 33911-8S, I believe.
That's correct.
Yeah.
If you just take us through the change from before, give us a little overview, and then I think if we could just give us some information, we appreciate that. And
So, I know there were a couple of things we were working on.
Chairman Dempsey, you just mind bringing that mic up to you a little bit closer,
Right.
so we can hear you?
As I recall, there were some questions about understanding lead abatement, the lead hazard abatement. And the wording in here still is removal and correction. That originated and matched DNR and their risk reduction and abatement program. The focus in all of this is on the child at risk. That's really where we're going. We're not trying to overreach into those who own the property at all. That is not the goal. I almost think we'd be better off just to start with questions and make sure that we are. We did remove. I think Senator Orrock mentioned at the very end, around line 182, the duplication of words there. So we did a little cleanup on there, where it reads now just it's very straightforward. On that, we did leave daycare facilities and schools as new language there, but y'all had that last time as well.
The risk abatement and risk reduction. Why don't we do that?
And if that's
introduce
okay,
your guests or have
Dr. Rustin can explain that a little
Yes,
bit
why
better.
don't you
And he participated on the study committee as well. So
Dr. Russ, just bring that microphone close to you. I think the committee wants to hear what is risk reduction, what is risk abatement,
Sure.
how often does that occur, and that
Sure.
kind of thing.
Sure.
If you don't mind, thank you.
Sure. So thank you, Chairman, and happy to be here to answer questions. We, as you see in the sub, we went back to the original definition that's associated with lead hazard abatement. What that does is it gives the department and its staff the opportunity to focus on risks in a home. And when we look at risks, what we're looking at is immediate issues that put that child at risk. And so, for example, if we're in the home doing a lead inspection and the hazards that we identify are windowsills, peeling paint next to the floor, those are the risks that we would ask the landlord to correct. We're not discussing full abatement where you have to go in and remove literally every single surface of paint in the home. Our inspections are targeted to be risk-based inspections. And we're focusing on those issues that are at most risk to the child, and putting that controls in place to protect that particular child. And in many cases with risk reduction, these types of things can be done with the family still in the home. Risk abatement plans can be written in a way that you can section off certain areas of the home. You can still protect the family while they're doing the work. That's very common. And it's really dependent on a case-by-case basis, and it's dependent upon the extent of the hazards found during the inspection. But our goal as an agency is to focus on the highest risk issues in the home, and those generally are lead paint. It's usually windowsills. It's usually doors that need to be readjusted in some cases because they're scrubbing, which makes it a friction hazard. And it's dust that's generated from these hazards. Those are primarily the primary risks that we see in the home. In some occasions, out in the exterior surface of the home, if there's exterior paint, we're looking in areas of soil where the child plays. If we find lead in that particular soil area, we would ask them to do something to mitigate that. It could be as simple as we've had landlords come in and remove the top 3 to 6 inches, resod it. We've had them come in and create some kind of barrier that prevents the child from playing in that area. And so our goal, again, is to focus on risk reduction. And very rarely do we see full lead abatement where they literally move every surface. It's not always practical. It's very expensive to do that. And again, our end game is to make sure that we're protecting that child and reducing those risks that are immediately apparent that we see during the inspection.
Does anybody have any questions at all?
Yes, I do.
Okay. What number are you?
9. I hear what you're saying, and I read it, that it's in a manner no more strict than what is determined to be absolutely necessary on line 51 through 53. Lead hazard abatement means the removal and correction in a manner no strict than what is determined absolutely necessary. That's very subjective, and so you're telling me that you all do the minimal amount required. DPH, I think, is who.
Yes, sir.
But it's so subjective, it just seems
So how many-
worrisome to me, I guess, that there's no definition really of lead hazard abatement. I mean, I think of abatement as, hazard suits and having to go into all kind of extremes, so.
So tell me, how many we had discussed this offline, and when you're talking about tinting or suits and all that, how often does that occur?
Very rarely for lead risk reduction.
So over the past 5 years, how many in your?
In our discussion, over the past 5 years, I only know of 3 cases where there's been like full lead abatement in the home, where children or the family has been displaced. In a couple of those cases, the landlord found other accommodations for the family. But I do want to address the subjectiveness, if I may. The risk assessment that is done is not subjective. There is standards around how we do a risk assessment. The standards are actually outlined here on the things that we're measuring against a certain number, whatever that standard is, 10 micrograms per square feet of floor dust, 100 micrograms. And we have a very standardized process for doing the inspection, where we follow the process that's taught by essentially by EPD as well as HUD, which is a standard process. All of our staff that are trained on that process, when they go in, they're trained on what to look for as far as what's at risk to a child. And generally, they're looking for things that are low to the ground because that's children are little people. And so it's not that subjective. At the end of the day, when the report's written, we base that report off, because we send samples off. We do dust samples on the floor. We may take paint samples. We take soil samples, water samples. We send that off to the lab. When we get those results back, we craft our risk abatement recommendations based off of those standards and those results that come in. And so we try to be very targeted on how we reduce those risks.
You follow up?
No, sir.
Okay.
That's helpful.
Thank you. Okay. Chairman Kirkpatrick.
Yeah, this is following up on a question I asked last time. I'm trying to understand the interaction between DPH and EPD
Sure.
on this. And then also, because just from simple math, it would seem that by greatly lowering the standard that we're going to generate a lot more kids that we're going to need to deal with. And I'm not sure how you do a fiscal note on something that you expect to happen, but it'd be nice if you could address that too.
Sure. So to address your question, EPD is charged with, and we consider them our sister agency. We work very closely with them on various all kinds of environmental issues. But EPD is charged with establishing the standards around training and certification. And so when our lead inspectors are certified, they're certified by EPD to do the inspection. They establish those standards and those trainings. They also establish the environmental cleanup standards for renovation. So contractors who do this type of work have to be licensed or certified by EPD so they know how to correctly mitigate those hazards without creating more problems, spreading dust, that type of thing. And so that's really the role. And then EPD is responsible for ensuring the lead waste is disposed of properly. Lead is a hazardous waste, so it has to be disposed of properly. DPH, on the other hand, is really charged with protecting the child, going in and identifying the risks in the home and putting control measures in place to try to abate those hazards. And so we work very closely with them. If we see there's problems with abatement, especially with a contractor, we would refer that to EPD for them to look into that contractor to make sure that it's being done correctly. To answer your second question, you are correct. By lowering the standard, we are going to capture a lot more children that are currently being exposed, and it is going to increase workload. In the fiscal note that was submitted, it does ensure that we have, right now we have 7 staff for the whole state. Some of our lead inspectors cover 30 counties, and so it's very difficult for them to give the attention needed at the current standards that we are. And so by adding staff to each of our public health regions, this particular person, their sole job will be devoted to doing these types of not only inspections, but education. The flip side to what they do is they work with the medical community, providing education to the doctor's offices. They get invited to speak at events on how to prevent lead exposure. And so it's kind of a dual role. And so that's how we're planning on addressing that issue. Thank you.
All right, Leader 4, Kennedy, Senator Kennedy.
Thank you, Mr. Chairman. And for the benefit of the committee and the chairman, I have worked with the stakeholders since our last hearing, and I appreciate that, and gotten some information. I know that we've made some corrections or improvements, I think, to this. So really 3 quick points. On lines 51 through 53, the supplement goes back to the original definition for lead hazard abatement, and I think that's a lot better and I think more acceptable and addresses some of the concerns. Okay. You're welcome. Yeah, so we're on 9118S. So I think that's a definite improvement, and I want to thank those that I've worked with offline. The question I would have, sir, is if you look on line 116, that sentence says that, well, right before that, the department shall require lead hazard abatement, and that's referring to the residence or a place where the child regularly attends. And then it says the department shall also require a lead hazard abatement at the supplemental addresses of the child. What are supplemental addresses? What does that mean?
So when we investigate, when a child is reported to us, and I think it might be helpful if I walk the committee through the process. And so most children are tested for lead in a doctor's office, or the physician will write a script for them to go to a laboratory to be tested. Lead poisoning, lead exposure is a notifiable disease in this state. So every blood lead result is sent to the Department of Public Health. Our team that's there screens those results, and based off the blood lead level, assigns these cases to lead inspectors in the state. When the lead inspector goes to the home, the first thing they do is interview the family, interview the parent or caregiver. And one of the questions they ask is, does the child visit other homes? Do they stay at grandma's house 3 days a week? Are they in a daycare? Because if we don't find lead in their primary residence, we have to look in supplementary locations. So these are the supplementary residents. May not be a residence, it could be a daycare facility. And so we would go to those locations as well to see if there's lead hazards in those locations.
Okay. Thank you. That helps. Mr. Chairman, one last question. So, and I would ask the sponsor of the bill maybe to address this, and we had some conversations earlier today before the meeting with some others. So line 189 to the original bill says the owners of residential rental property that accept compensation for the use of residential property by another. And I think there's some question about is some of that language superfluous. And I think at first blush, maybe it is, but I think if we look at it a little closer, it's really not, in that if we change subsection 1 to only say owners of residential rental property, like is proposed in the supplement, then I think we're capturing property of a landlord that is not used for rental purposes, such as their own personal residence or vacation home or other properties that they may have that's not residential, or excuse me, that's not rental properties. And as I understand, Representative Dempsey, the purpose of this is to apply to rental properties. And if
It
that's
is.
the case, my recommendation would be that we retain the original language from your bill of on line 189, and that little more comprehensive definition for number 1.
And I may not have the original bill in front of me, the totally original.
The committee has it in front of it, so that was LC 338986, and
what
it appears
does
in your
that-
folder as pink.
Okay.
And that was part of the change. So in LC 339118S, what Senator Kennedy is talking about on line
Yeah, I see it.
189 in the pink one,
Mhm.
keeping that language there, that accept compensation for use of residential property by another. And that would be on line 182
Right.
in the substitute.
Right. And we had taken it out because we thought it was duplication, and I think that came up in the conversation when we last presented. So it's a matter of, I would say, what your preference is, what you think makes it most clear.
And my recommendation would be to go back to your original language, because at first blush, it does look superfluous, but if you read it in its context in the supplement, it would then apply to beyond what we're talking about and beyond the intent of your bill. So,
No, I appreciate that.
Yes,
That
ma'am.
was, I think that would be good. So y'all would want to
So,
make that amendment.
yeah, when
I
we
guess.
do, presumably someone's going to make a motion to pass, and we'll get a second, and then we'll do an amendment, and we'll see if that passes, and then we'll vote on the big bill. I just want to make sure we have any further questions right now. I think that's reasonable, and hopefully we can do that on the fly. I'll accept that as improvement. So if there's no further questions, I don't see anybody. I do see got a motion to do pass from Chairman Huffstetler.
second.
And a second from Senator Kennedy. And the further discussion, Senator Kennedy, let me recognize you.
Thank you, Mr. Chairman. I would recommend that we add or change line 182 on the substitute bill that we're all working with, striking what is there and replace it with, and I'm reading again verbatim from the sponsor's original paragraph number 1, quote, owners of residential rental property that accept compensation for the use of residential property by another, semicolon.
So, Betsy, we got that? Okay, and is everybody clear on that? Let me make sure everybody's clear. Is that a second or a question?
No, I had a question on that.
Okay, all right, so let me get a second first, see if we have a second. Got a second? All right, from Hatchett, Senator Hatchett, and then Senator O'Rourke.
Yeah, let me pose a hypothetical. If an owner of residential property, residential rental property, allows a relative or a friend or a family in need to stay in that residential property and waives any compensation for that, and that child is found in a doctor's office to test positive for lead, wouldn't we want that property that's a source of, if it's proven to be a source of a lead contamination, wouldn't we want that to be covered? Whether or not they're accepting rent from that family if the child's tests with a dangerous level of lead? I'm
wanna
just
answer that?
asking, I mean, the question is, does that not create a loophole that we might?
Well, I don't think it creates a loophole in the sense that if we're targeting landlords, we're targeting people that own property, that rent it or lease it out to the public. They're going to expect and demand compensation in some form, otherwise that business model is not going to last very long. What I'm addressing here is, or suggesting, is the language as written in the supplement owners of residential rental property is going to then encompass property, their own home, or other homes that aren't used for purposes of rental. Because the definition is owners of residential rental property. If you own a residential home and you lease it to someone, not only is that house subject to this, but your private residence is subject to this. Any other home you own is subject to this because the definition is you're simply an owner of a residential rental property. And so I understood the sponsor's intent to address the homes that are rental homes.
That was the focus.
Yes.
At this time. It's not that there is not more, with due respect, absolutely. But that was what this is doing at this time.
Thank you.
Any further discussion? All right, so we're in the posture of the amendment. Let's vote on the amendment first. So does everybody understand the amendment? It was well spoken. We got it listed there. So all those in favor of the amendment, raise your hand. Eight, and all those opposed. All right, so I think we got more than 8 people in the room. So the rules are that if we're sitting at this table, you got to vote. So either you can't be sitting at the table, you got to vote. So let's vote on it again one more time. Let's get it right. All those in favor of the amendment, raise your hand.
Enforce it when they want to enforce it.
All right, 1, 2, 3, 4, 5, 6. All right, and all those opposed. Okay, there we go. All righty, so that is the amendment. So we're in the posture of the substitute House Bill 1355, and this is LC 339118S, and then the as amended. Did I say that correctly? As amended. So all those in favor, raise your hand. And that looks, that's got it. And all those opposed? Got one opposed. Gotcha. Okay. Thank you so much. All righty. And
Believe you're carrying
yes,
it.
so I'm carrying that on the floor.
Thank y'all. Thank you for improving it as well as embracing the original language. I think it will all work well. Thank you.
Thank you. We appreciate it. So we are at House Bill 937, Representative Henderson, and so at 937. So we are dealing with, it's in your folder, at LC 339111S. Okay. Floor is yours.
Okay. Good afternoon, Senate Health and Human Services Committee, and also to Senator Ben Watson, Chair. Thank you for your time. I am Representative Sharon Henderson, and I come before you today to introduce HB 937. This bill has a personal value to me because I was diagnosed with a rare early stage of breast cancer 4 months ago. And I say rare because doctors at Cancer Treatment Center of America had not seen such an early stage in over 20 years. After 3 months of treatment, last month, I rang the bell, cancer-free, because of early detection. My bill adds language that would require insurance companies to send notifications to women upon reaching age 40 to have an annual mammogram. early detection saved my life. During my time at Cancer Treatment Center of America, I met a young lady. Her name was Shelley. Shelley was 43 years old. She did not have a mammogram at age 40, and cancer was discovered when she was a stage 3. Cancer had spread from her breast to her liver, to her kidney, to her rectum, and she was in a wheelchair with a colostomy bag. Shelley said to me, "Miss Henderson, I heard you ring the bell, cancer-free, and I wish that was me." Immediately upon hearing those sentiments from Shelley, I started venturing out with this bill. And there are many Shelleys, many women that do not make time to take care of themselves and have an annual mammogram. So therefore, Senate Health and Human Services, I sit before you today with this bill. This bill will allow many women to see sunshine and have a better life, cancer-free. So I ask for your favorable consideration, Chair, in this committee for this bill. Thank you.
Thank you, Representative. Any questions at all from the committee? Probably one.
Thank you for bringing forward this bill. Just a question, because I have been seeing I've been getting mammograms, but also seeing a specific breast doctor since I was 30. My question is there an age at which women are referred to get mammograms currently, and if so, what? Because I've just been doing it so long, I don't know.
The American Cancer Society has recommended it for years, starting at age 40 plus, and every year thereafter to get your annual mammogram.
Thank you.
Any other questions? All right, seeing no further questions, I'll entertain a motion. Motion do pass Senator Orrock, seconded by Senator Halpern. Any further discussion, questions? All those in favor, raise your hand. Looks unanimous. Thank you. Thank you so much.
Thank you.
Appreciate that. And did
Thank
you
you.
have someone carrying that for you? You can get to me afterwards if you hadn't. Okay.
No, sir, I don't.
Okay. Why don't you
It would
get
be a
to Ms.
pleasure
Day?
if you could, Chair.
My plate's getting full. There's a small bill called 1013 that's in the committee, so we're working on that a little bit. So maybe Senator Halpern or Senator Butler is asking
Senator
to do that.
Butler.
You have someone volunteering. So
Thank you, Senator Butler. Thank you.
so the minority leader, Senator Butler, will be carrying. Thank you so much.
Thank you.
All right, last but not least, here we are, House Bill 1219. So if this does have we're on LC 33901-2S. Chair Lady, thank you so much for being here. The floor is yours.
Thank you. I bring you House Bill 1219. As many of you know, I'm from a rural area, and dental care is very scarce in rural areas. Unless you get the Smile Bus, so many people do not have dental care. And I was very fortunate that my federally funded health clinic, when I approached them, was willing to offer dental care through my federally funded health clinic. And I had a dentist who was retiring and agreed to give all of his equipment and everything to the federally funded health clinic for dental care, but we can't find a dentist. And In fact, y'all were so gracious, I got some money in the budget last year to help pay for this transition for a dentist in rural areas, but we can't find a dentist. So therefore, I brought this bill. I'm changing proposing to change the number of members on the Georgia Board of Dentistry from 11 members to 17. The 17 members will be 13 members as dentists, 1 member not a dentist or a hygienist, 1 appointed by the Board of Regents with direct knowledge of education of dental students, and 2 members as hygienists. I'll be glad to answer any questions.
Do we have any questions from the committee? Senator Orrock?
Yeah, thank you for bringing the bill, and again, we see the need to address the rural-urban divide in Georgia and look at meet the needs of high needs of rural areas. And I thank you very much,
Thank you.
Representative Houston. You've been there on that issue over and over. My question is, such a low number of dental hygienists who play that pivotal role. They're the portal to dental care and getting those regular cleanings and assessments under the authority of a dentist. I'm not recording you. This iPhone has a mind of its own.
Oh, that's fine. I don't mind.
Even when
You
it's
know,
turned off.
Everything I do is public
Even when
record.
it's
She's,
turned off, it won't take a vibrate message. So I apologize.
That's okay.
But I was just pointing out the huge imbalance between the dental hygienist and the dentist.
Well,
And
this
they're
is-
part of a team, of course, and so.
This is a part of the team, and we did increase the number of hygienists on there. And my point is trying to get dentists out in all over Georgia. We don't graduate enough dentists in the state already, and I want more dentists because Georgia's population has increased. And as you know, Emory used to have a dental school years ago.
Yes.
And I'm sure you're aware of that. Some other people on this probably weren't born when that happened. But it's to get more. The object is to get more dentists.
Just one follow-up question. So dental hygienists now can practice, can do what they do in the service of dental patients with the oversight of a dentist. And current law, the dentist can do that with the hygienist can be at a location, and the dentist doesn't have to be.
I
Or
don't
you
know
don't know the
rules of
answer?
hygienists. I know my
Yeah.
Wiregrass at my technical school does train dental hygienists, but the dentist, the dental school is under the umbrella of the Board of Regents,
Mm-hmm. Yeah, I understand that.
and not the technical schools.
Any other questions, Senator Dr. Owl?
Hi, thank you so much for coming to present this bill. Just a question about the function of the board. So am I correct in understanding that the function of the Board of Dentistry is for licensure purposes, regulation, that type of thing? Can you explain what the function is?
Yes, that's what the function of the board is. The only thing we changed in the bill, that's existing law, we just want to change the number of members. That's the only thing we're changing.
So that's sort of my follow-up question is, how does increasing the number of members of the dental board address the shortages in
Well,
staffing? Because that's obviously a problem that we see
Yeah,
in
it's a
many fields
problem
of
we
medicine.
see. But, since this dental board was established, Georgia has grown so much, and this will give us more representation and more people that might have some bright ideas about how we get more dentists.
So is the goal to have more geographic distribution in terms of the types of
Well,
people
I think
representing
so.
on the
I
board?
think we get more geographical,
Is that
but it's
part of
not
the-
in there. We can recommend that the governor appoints the members of the dental board.
I guess I'm just confused how increasing
And
the
we're
size of the
also
board.
increasing it by putting a member of the Board of Regents on there.
Sure. I guess I'm still confused as to how expanding the size of
Well-
the board addresses
Well, we're just
recruitment and
desperate to do
retainment.
anything. If you can think of anything else we can do, we'd be glad to do it. But this is best, we feel like this will make us get more dentists, and we're just trying to get more dentists. my thing is to get more dentists.
Okay, got Senator Kirkpatrick.
Yeah, I should know the answer to this, but are dentists covered at all under the Healthcare Workforce Board? Do you know?
I don't know.
They are.
I have somebody here from
You're
Augusta University. if y'all
Phoning
would
a
like
friend
to-
back there, they say yes, they are. Thank you.
There's someone here from Augusta University if y'all had to want to ask them some questions.
Any other questions? Do you have questions, Senator Halpern?
Kind of going back to both the questions that we were just asking. So there's substantially more dental hygienists in the state than there are dentists. I think that number is 1,600 more dental hygienists. And I know there's some trend, I believe, to even expand to the point that you're making about increasing the number of people who can actually practice oral hygiene in somebody's mouth. Expanding even the role of dental hygienists. I guess the question is, given the weighting of dental hygienists to dentists in the state, and if the idea is to create this board that's going to promote just generally better oral hygiene in all of the areas of our state, it does strike me that there is still a bit of imbalance with only having 2 dental hygienists. And I'm wondering.
Well, I wonder if maybe I'm not up on dental hygienists, but I just wonder, the education of the dental hygienist is a little different from educating a dentist, I would imagine.
I think that's right, although.
There is a difference there.
Yeah.
Okay, thank you. Any other questions? If not, I'll entertain a motion. Move do pass.
Excuse me, sir. We had, we wanted to speak on this issue. Christy Smith of the Georgia Dental Hygienists Association. I had asked this several
Do
days
we have
ago.
that?
Thank you. Thank you.
Good afternoon. Thank you so much for allowing me to come forward to speak to the Health and Human Services Senate today. My name is Christy Smith, and I've been a hygienist for 24 years. I graduated in '98 from the Medical College of Georgia in Augusta, and I'm very proud of that. I wanted to talk to you about the fact that dental hygienists, the numbers of dental hygienists are significantly higher in Georgia over our dentists. And I'm friends with many dental hygienists. You all have had dental hygienists in your mouths over the years, and they're probably a friend of yours. They're probably someone that you care about and you fuss over if they're not there. And there's a fill-in. I'm a fill-in sometimes because I can't stay away from teeth. Filled in yesterday for a guy in Calhoun, Georgia, and everyone was like, "Where's so-and-so?" And I said, "She'll be back. Okay, you're going to be okay." My journey is this. I am an educator at Georgia State University. I was the interim director for the new bachelor's dental hygiene program there. I've been a medical supply business owner in Georgia. I have taught high school for 7 years, dissected pigs in anatomy classes in Calhoun, Georgia. Currently live in Summerville, Georgia. We are here to talk about 1219S because we need 2 additional dental hygienists. We are not being adequately represented. We need to be heard. We need to explain why we need to be able to go into nursing homes and to Title I schools and places where no one seems to want to go, but we do. We're ready. We're chomping at the bit. And this is our time to tell you that we are extremely educated. We have the same credentials as an RN on prerequisites. We actually have more prerequisites than an RN. We have 5 semesters of dental education, and dentists have 6 to 8. So we know a lot about the mouth, and we spend a lot of time in your mouth, and I think that you appreciate the fact that we are clinicians and that we know our stuff. We study oral pathology, we study dental anatomy, pharmacology, dental materials, periodontology, which is disease of the teeth and mouth, x-rays. I've taught all those courses myself, and I can tell you that the 8-hour written exam that dental hygienists have to take It's 8 hours of written exams we have to take to pass the board. We then go to take a 2-hour clinical board on a actual patient, and that's not required by RNs. You know, they just take the written board. So heck yeah, excuse my French, we are ready to make a difference in Georgia for these people that need us. You have people in your community that need us. We are willing to go to places that a lot of people are not. We have associate level, bachelor's level, master's level, and doctorate level dental hygienists. Do you know what education your dental hygienist has? Have you ever talked politics with your hygienist? Maybe not. Maybe you should. They love talking politics, and they would absolutely love to know where you stand on their future and their patient's future, okay? So we are 50% of the licensed dental professionals in Georgia, and dentists are 44%. We need adequate representation on the board. Let me show you on your worksheet that you have in your folder that the average state that has a 17-person board has 4 to 3 dental hygienists.
Thank you so much.
This page right here. Do we have a worksheet? You should. It was given to you and asked to be entered into your folders today.
I will tell you, we're addressing the dental board, and I appreciate dental hygienists are some of my favorite people.
Yes, of course.
And they are. I see them 3 times a year, and I love going. My wife loves going.
Yeah.
I appreciate that.
One more thing, and then I'll be done. Healthy People 2030 says that we have got to expand the role of dental hygienists beyond traditional dental settings and incorporating the use of these not so typical titles, and that's just important that you guys consider that.
We
So,
appreciate that.
Thank you.
This is a reorganization of the board, and thank you very much.
Could I ask a question?
Yes, ma'am.
I wanted to ask the presenter if you could just fill the committee in, fill me in on how dental hygienists work under the direction of dentists, and are you able to at this point go into and your comments address the bill, because the bill adds more dental hygienist slots on this board, and you're requesting a larger representation on the board of dental hygienists. Is that right?
Correct. General supervision. It used to be if the dentist wasn't under the roof, we could not pick up instruments and use them on patients. It has changed. We may now go into nursing homes, Title I schools, dental mobiles without the dentist being present, but under general supervision. We can do things that hygienists are willing to do that no one else is willing to do a lot of times. By having the extra feedback from dental hygienists on the board, we can vote and make sure that the community and the people that are forgotten, the target populations that are underserved, are served for the first time. They're not being served. It has to be changed, and dental hygienists are the grassroots of this.
Well, and this, my follow-up is dental hygienists, I know they always examine the tongue and look at the palate and
yes.
the general health of the mouth.
Yes.
And they absolutely connect the patient with the dentist.
Yes, and people trust their hygienists. We spend more time with the patient more than any other role in dentistry. We spend on average an hour every appointment, and that's just not something that patients get with any other role, and they do trust us. So we feel like this is a good starting point to allow hygienists to have more of a say.
Thank you.
Thank
you so much. Appreciate that. You have a...
Yes, sir, Mr. Chairman. And I apologize for stepping out. My question is for Chairman Houston. Chairman Houston, I understand there are 11 current members on the board now. Excuse me for being late. What's the need for the change from 11 to 17?
Well, I don't think they're getting enough dentists out in the state, and I think if we increase it, we might get some more dentists out. And I explained why I came here to do it, about my problem about getting a dentist. I'm sorry you didn't hear my explanation.
Yes, ma'am. I apologize for.
I had some money in the budget for a federally funded health clinic dentist, and I got a dentist that was retiring and was giving all his equipment. I can't find a dentist.
Madam Chair, that I understand first hard. I have a practice down in Savannah, Georgia. I can't get a dentist to work for these 3 months I'm here. So yes, ma'am, I understand.
I understand. Thank you. So,
But I just need, but the question is, increasing it from 11 to 17, how would that get a dentist at 1501 Abercorn Street in Savannah, Georgia, and in your
I've
county?
got some people here with their
if we need
questions.
AU to, would you like for them to come up?
Would you, if they'd like, AU
Yes,
would like
ma'am.
to come speak.
Okay.
Yes, ma'am.
Dr. Keeler's not here, but we do have somebody else.
Okay. Who's
do we
from
have a rep from
the
the dental
Dental,
board also?
School of America? Or I'm sorry, Dental School of America. I got you. Okay. Thank you.
Hey, I'm Ashton Blackwood. I work for Government Relations at Augusta University. We are the home of the Dental College of Georgia. I can answer what questions I can. If I don't have an answer, I can come back to you.
Oh, my question was, increasing the dental board from 11 to 17, how would that promote bringing more dentists into rural Georgia other than other parts of Georgia where there's no dentist?
Okay, so I can't speak to that directly because I don't sit on the board, but I can tell you that our students have had a challenge over the last couple of years being able to get an exam, and we've lost many of them to other states. So I'm hopeful that changes. We're working to have other exam options and things for them, but I can't speak directly to the board as I don't sit on the board, but I can speak to our students directly.
And I think that goes to the nature of the reorganization of the board.
Okay. Do we have a representative from the board, Mr. Chairman?
Be happy to entertain them. I don't think there's anybody that's been here.
Have the current Georgia Dental Board brought testimony or sent a letter expressing their views?
No, they have not.
And the bill has been there for a while. I haven't heard from
And I think that goes to the nature of the reorganization of the board that's necessary. I'll entertain a motion.
Okay.
It got a motion to do pass from Kirkpatrick and a second by Chairman Hatchett. Any further discussion? If not, all those stand. All those for passing, let's see, LC 339012S, House Bill 1219 by Representative Houston. All those in favor, raise your hand. All right, 6. And all those opposed? 5. 6-5. It passes.
Y'all, this
Thank you.
is not a partisan bill. Everybody has teeth.
There we go. Thanks so much. There's a meeting other than health in this room, so if they need seats, they have precedence. And then we have a subcommittee meeting at 3 o'clock. Meeting adjourned. Thank you.